Good evening, guys. Hi, thank you for being here. So I'm going to keep the didactic part of this talk very short. So I'm going to be speaking to you for not more than 5 to 10 minutes, and then I'm going to open the house for all your questions. So so let's start. So what is MRCS? MRCS is the member of Royal College of Surgeons. There are 4 Royal Colleges, and it is the Royal College of Surgeons of Edinburgh, of which I am a member. It is the oldest college. Member of Royal College of Surgeons of England, Royal College, which is also extremely more than 300 years old. We have the College of Physicians and Surgeons of Glasgow, and then the Royal College of Surgeons of Ireland. And MRCS Part A is jointly conducted. There's a joint committee which conducts the exams multiple times every year, usually January, April, and September. So 3 times a year, the exam is conducted. Exam can be either an UK exam or it can be an international exam. So for international candidates, we would advise you to apply through the international section. Who can apply for MRCS Part A? So the MRCS Part A is an entry-level exam. So if you think you can be a consultant after MRCS, no. Not even in the UK, you can be a consultant. Even in the UK, it is a way to enter into advanced surgical training. So UK trainees, they do MRCS at the end of 2 years or during this course of 2 years of core surgical training, where they are called CT1 and CT2. And after that, they enter into almost 4 or 5 years of 5 or 6 years of surgical training, advanced surgical training, which starts with ST3, ST4, ST5, ST6, ST7, even ST8. After they do an FRCS, they get a CCT, Certificate of Completion of Training, and then they are called as a consultant in the UK National Health Service, NHS system. For Indians, there are 2 types of people. Either you can be a post-MBBS student who's entering into the MRCS pathway, or you can be a general surgery resident or a general surgeon who is doing his MRCS Part A. Simple MBBS is enough. And to pass MRCS, what all documents do you need? Ideally, you need a passport, a valid passport. Or if you don't have a passport, they might accept a valid photo identity card. You need your MBBS degree certificate, not a provisional certificate. You have to ideally complete your internship also to write MRCS, because you don't get a degree certificate without MRCS. A lot of people who are trying to write MRCS during internship, it really doesn't work. So how is the MRCS Part A exam conducted? So 19th, today is 17th. So 19th, the deadline ends at evening 5 o'clock. They're going to close the MRCS applications. It's going to be very difficult for you to apply for it after that. After you do that, about 45 days before the exam, or a month before the exam, you will get a login for a Pearson VUE portal. The Royal College of Surgeons of Edinburgh or the England, whoever, they will send you the mail, and you will be allowed to log into the portal to choose your center. And that day is going to be very crucial, because on that day, most centers in India get rapidly filled up. Sometimes you might have to choose an international center, Dubai or anywhere else, but 99% of the people are able to get a center within India. Sometimes after the filling closes, they open a little more centers or add a little more seats. So the Pearson VUE Center is present in almost most cities. It's present in Chennai, Bangalore, Coimbatore, Indore, smaller cities, Tier 1, Tier 2 cities, multiple centers in India, including Mohali, Guwahati, and everywhere. So don't worry too much about the location. You're going to be writing it like how you would have written your NEET PG or NEET SS or any of these exams. You write it in a computer testing center. What is the pattern of MRCS Part A? It is divided into 2 parts. And the first part is applied basic sciences. And the second part is principles of surgery in general. And it is divided into 180 and 120. So the topics which are covered are, I'm going to be talking about it in a little detail as well. So what are the topics which they're going to test you on? So they're going to be testing you chiefly on, just a second. So applied basic sciences includes anatomy. Anatomy usually has around 75 to 80 questions. Usually it's around 75 questions. And thorax is about 6 questions. Abdomen is a big chunk, around 15 questions. Pelvis and perineum around 6 to 8 questions. Upper limb and lower limb anatomy is extremely essential for your MRCS Part A, and it is around 15 to 20 questions. And they essentially test nerve injuries and the practical aspects of anatomy. And for this, I would say your Mortimer Green app is excellent. Do use the resources very well. Head and neck is around 10 questions, out of which 5 is head, 5 is neck, and about 5 to 6 is around brain. So around brain and autonomic nervous system is around 8 questions. And there'll be a little bit of embryology, 3 to 4 questions. Surface anatomy is again about 3 to 4 questions. You will have questions in surgical physiology as well, the bulk of which is going to be GI physiology, renal physiology, endocrine, neurological, cardiovascular, also they ask questions, but GI, respiratory, and renal physiology are going to be the bulk of this thing. Pathology is actually the easiest of them all. The most important resource you need is just a question bank where you can answer questions. General pathological principles is the maximum, but then they ask questions on transplant, they ask questions on surgical hematology, principles of neoplasia, all the topics which you read in your general surgery Bailey and Lau textbook itself. And then there's a big chunk of systemic pathology. So physiology is around 45 questions and pathology is around 40 questions. 37 to 40 questions is around pathology. We will have questions from pharmacology as well, about 8 to 10 questions. Microbiology, again, 7 to 10 questions. Imaging can be across categories. Imaging, they might ask you X-rays, CT scans, or MRI, but it's not going to be too difficult. They're very simple. Usually they ask a pneumothorax or something of that sort. Data interpretation and audit, about 3 questions, which is pretty important as well. Principles of surgery in general is the easier part. If you're a general surgeon in India, if you've read your surgical textbooks, POSG, which is about 120 questions, is easier. They ask questions from GIT, breast, vascular. GIT is obviously the chunk of this thing. Good amount of questions from breast as well, lymphoreticular system. A solid chunk of the questions, around 35 questions, is from perioperative management. And I feel that is the most important part of your surgical exams. That's pretty important. There's a solid amount of questions on trauma. Burns is an important topic, 4 to 5 questions. Wounds, shock, fractures and dislocations, organ-specific trauma, extremely important. This particular exam, pediatric surgery, is around 7 to 10 questions, and it is more than sometimes even breast or colorectal. So do make sure that you learn pediatric surgery. A very interesting aspect is the medical legal aspect of surgery and UK health, where they ask you questions on how the NHS is structured, principles of good governance, medical legal aspects, scenarios in which a patient is refusing surgery for a life-threatening condition, scenarios in which a patient is a Jehovah's Witness refusing blood transfusion. What would you do in this particular situation? Your colleague is smoking a joint, smoking weed in the changing room during duty hours. What would you do? These are all questions which are pretty important. And I can assure you that I'll be guiding you through the entire process. We're going to be holding our first class of our testing discussion on 19th. And on 19th, my first session is going to be medical legal aspects of surgery, where I will be covering each and every aspect of pathology as well. We are planning to launch our video lectures soon. I don't know if it's going to get ready by January, but we are trying to launch it within a month or so. And what is the scoring pattern? So the scoring pattern is that you will have to pass in both the sections separately and also pass overall. And there's a concept called as standard setting. Standard setting is a very interesting process for MRCS Part A. They follow something called as the Angoff procedure. So 20% of the questions in your exam are surely from the previous year question papers. Sometimes it can be more also, sometimes it's less also, but usually the standard is that 20% of questions are from previous. That is to make sure that the standard is set. Your performance mark depends on how your colleagues are performing, how people are performed in the UK exams, what is the candidate feedback regarding questions, whether they should disregard a question or not or something. And then they give you marks. and usually it is around 70%. Sometimes it can be 69% pass mark. That pass mark is decided every exam separately. So there's a different pass mark for every exam because each exam is different. Each exam has a different pass mark. So about 69 to 72 is the passing mark. Some people ask me if I apply for RCS Edinburgh, will it be better? Sometimes what happens is that the passing mark for different colleges can slightly vary. For example, Edinburgh it can be 70 and England it can be 71. So your senior would say, don't try Edinburgh, take England because pass mark for Edinburgh is lesser. That is actually simple nonsense, because ultimately your senior also doesn't know, the examiner also doesn't know, you don't know, nobody knows at the end of the day what is the pass mark for that paper. But it depends on what the kind of students who have written exam over here. And candidate feedback will be provided, and if you feel that any question is wrong during the exam, you will have to do it. Please reserve the questions for the end. I'll be finishing in about 5 minutes. And one more point which I wanted to cover is, so the core topics in which is something we'll start saying. And how many attempts are allowed? So 6 attempts are allowed for MRCS Part A, and your MRCS Part A is valid for 7 years. You will have to pass MRCS Part B within these 7 years for sure. And they might give you an exception if there's a big calamity, there is a war in your country or something of that sort. They might allow you to this thing. So what is the scope of MRCS Part A? So multiple people, if you want to go to the UK, you have to do MRCS Part A. That's for sure. We'll hold a special session on careers in UK next week, and I'll make sure that it's available free of cost for all, not just a test and discussion users. But first thing, it offers a lot of credibility in the corporate hospital setting. Patients look at you and they think there's an MRCS degree. It allows you flexibility. At any point of time, you can go to the UK, start a career at any point of time. If you're planning to go abroad, Middle East, Singapore and all, it definitely plays a role in giving you an extra salary at any point of time. So yes, this is a basic overview of the MRCS Part A exams. And now I think I will answer questions. Ask the questions, preferably not in direct, but in the overall this thing, so that people can say, So I got a message saying I've subscribed to the MG app. You can ask any question you want. Let me make it very clear. And registered with the RCS England on 7th of October and sent them a mail with degree certificate. I haven't got any response despite multiple mails. Can't get through the phone line. So make sure first, if you're calling them on phone, make sure that you are calling them in the UK timings. We are about 5.5 hours away. Second thing, the Royal Colleges are known for being notoriously late, lazy. They are not Indians. They don't think that they should answer a phone call immediately. So they will take about 7 to 10 days to answer your questions. Have some patience. They will answer you. And if they don't, you can send them a follow-up mail. Make sure you send the mails on the same thread again so that you can follow it up and they know. Is MRCS mandatory for doing FRCS? Yes. From 2023, it is. Dr. Sai has asked me, possibilities of becoming surgical gastroenterology in UK. There is nothing called a surgical gastroenterology in the UK. There is a colorectal surgeon, there's an HPB surgeon, there's an upper GI surgeon. And you will be choosing those pathways during your specialty training, advanced specialty training. So ST3, ST4, ST5, ST6, ST7, ST8, those years you can choose to be in upper GI surgery, colorectal, and you can do post this thing. Is Part A same for surgery and for ENT? Yes, Part A is same for ENT and surgery. What if I want to choose the center out of India? Absolutely, you can choose the center out of India as long as you make sure that the list of centers, Philippines is there. I'm not sure whether it's there in Philippines, but Malaysia, Singapore is definitely a center. Is it necessary to send physical documents to Edinburgh? No, you don't need to send any physical documents to Edinburgh. Yeah. If a student does not qualify JAM session, wants to go for the session, yes, he has to pay 580 pounds again. Yeah, you will have to do that. Unfortunately, yes, if you fail an exam, you'll have to fail. The only thing is that you cannot, you don't need to fill in that long documents send the documents again if you're applying to the same college. Is MRCS Part A post? Yes. After DNP surgery, it will be easy. It's going to be definitely easy to do it after surgical training. Preparing for MRCS Part A is different for everyone. For a post MBBS students, the basic sciences are going to be easy. For a post general surgery, it's going to be difficult. It's going to be basic sciences are going to be difficult. The surgery part is going to be easy. After DNP surgery, clearing it will be easy or difficult. Yeah, I answered that question. Edinburgh versus England versus Glasgow, it's all the same, buddy. There's no difference. I would prefer you guys if you do Edinburgh or England for only one reason. Again, Part B, when you're applying, you don't need to send the documentation. And if you've already done Edinburgh or England, you apply to the same college. Application process is easier because Edinburgh and England conduct their exams in a lot of their exams in India. Yes, Glasgow and Ireland have also started conducting, but the frequency is lesser. So that is my personal advice, but ultimately you will have to choose what you want to do. Some people have this thing. My father was an FRCS from Glasgow, so I want to do Glasgow. Absolutely go ahead with that. Thankfully, I didn't have a father who did FRCS or MRCS, so I had that opportunity to choose. I'm just going to start my preparation. Is it possible to pass Jan 2024? Yes, it definitely is possible to pass in Jan 2024 if you are an MBBS student, but you will have to spend a little more time. You'll have to spend around 4 to 6 hours every day, not just 2 to 3 hours like a person who has done surgery. So if you're willing to put that 4 hours every day, if you are able to solve the MCQ bank twice on the Mortimer Green app, let me tell you. So someone has asked me in private messages, is the Mortimer Green app different from EMRCS? Yes, it is different. All the topics that are covered in EMRCS are covered in Mortimer Green app, one. But the real challenge is that the Mortimer Green app is slightly tougher. And we found that over the past years, the questions are getting tougher. And our students are also giving feedback. Initially, when I started the Mortimer Green app, a lot of us told us, sir, your questions are too tough. Are they? I don't think that's real MRCS. No, the exam is getting tougher. So you will have to use a little higher standard of questions. Yes, the Mortimer Green is of a little higher standard. But if you feel not comfortable, then you stick to EMRCS. But if you definitely want to increase your chance of passing, I would suggest that you use MG app. The test and discussions give you an idea about how the exam is going to be, what topics to focus on. We're going to be discussing some nice guidelines as well. So it's going to be the same. If you are a second-year general surgery resident and if it's your second attempt, give the exam if you have around 2 to 3 months of time with the ability to prepare for 2 to 3 hours every day. If you can do that, then I don't know what's the nature of general surgery in your department, but that's how it is. Yeah, the what training level should be selected, you can just select others. So for all the training level, deanery, others, not specified, is that you'll have to do it. Yeah. If you clear Part A and if you didn't clear Part B, do I have to give Part A exam again? No. You can just need to give Part B. So how to go about theory? Theory is for general surgery part, I would suggest that you read Bailey and Lau. Don't try to see too many videos. Don't try to read a lot of theory from Sabiston or anything. Just simple Bailey and Lau is enough, which is basic MBBS level. 1. Number 2, for anatomy, use the materials which you have already prepared during your PG days. If not, you can use resources such as KenHub, KE and HEB. We will also be launching an MRCS Part A videos really soon. Is MRCS mandatory before I take up FRCS urology? Yes, it is mandatory. Is it wise to do MRCS after MCH? Around 20% of our students are doing MCH or have finished MCH. They wish to pursue further training in UK or they wish to work in the Middle East, looking for better opportunities than India. So yes, it really depends on what you want with life. And corporate hospitals do prefer an MRCS also. It's not that MCH is a lesser degree. MCH is a much bigger degree than an MRCS. It's a specialty, super specialty degree. But an MRCS adds a little value, an international degree. Can I postpone exam from Jan to May session after payment? I don't know. It's kind of difficult, but mail them and try asking them. But do that really, really soon. If you waste time, just 20 days before the exam, you'll not be able to do. If you're in your final year of MBBS, concentrate on your final year MBBS. Focus on surgery, whichever book you're reading. Focus on anatomy. You'll be able to write your MRCs only after internship. So be aware of that. So I think there's a question, how many months of preparation are needed? So you need 2 to 3 months. If you're very good with general surgery, reasonably, 2 to 3 months is more than enough if you can study for 2 to 3 hours every day. Prospects of breast oncology in the UK, it's an absolutely fantastic field. There's a lot of opportunity. If you've done your general surgery in India, you will be entering it at ST3 level. Spend 2 to 3 years in the UK till you go to ST5. Opt for a breast surgery unit. Stay in a breast surgery unit. Publish with them. Write your FRCS exam and become a consultant in the UK. The entire process of application. The entire process of application is very simple, buddy. You will have to, before 19th, you will have to go register on RCS England, Edinburgh, Glasgow, or any website. And what you'll have to do is that you will have to register. There's a very simple registration process where you'll have to fill in your details, you'll have to fill in your particulars, you'll have to fill what stage of training you are in. And because it's going to be calibrated to the UK system, much of it will not apply for you. So you'll have to put others not specified. At the end of it, you'll have to pay around 550 pounds, which comes to around 500 to 600 pounds, depending on the college. Again, it comes to around 40 to 45,000 to 50,000 rupees is what you need to pay at the end. And that's it. You'll have to submit your documents. Your documents include mainly your medical degree, most importantly. Yeah. See, there is no concept of a fellowship in UK. You will have to get a job, and your job is going to be a non-training job, most probably, because it's very difficult, almost impossible to get a training job in the UK. So only if you get into a training job, you can directly become a consultant, allowed to write FRCS. Or else you'll have to go through a pathway called the Caesar pathway, where you'll have to get all your skills certified, whether you can do an appendicectomy, whether you can close the abdomen, whether you can put mattress suture, every single thing your consultant has to sign after seeing it. It's a little bit of an headache process, but it's doable. A lot of people are doing it. Some of our own mentors who will be taking classes for you are undergoing that process. So they will be guiding you through that. So doing senior residency in India, does it help getting a ST3? Yeah, obviously. I mean, it doesn't make a difference. If you've done your 3 years of general surgery training in India, you can directly go to ST3 level. But if you have not done it, I would suggest that you don't go at ST3 level, because at ST3 level, they will be expecting you to perform surgeries. They will be expecting you to do an appendicectomy. You don't want that risk. If you get into the UK system, try to stay safe. If you're not confident about your own surgical training, apply at ST1 or ST2 level, which is basically core surgical training without the academic work. Yes, once you have registered for MRCS Part A, you need to send documents. It varies slightly from college to college. Edinburgh, they expect you to send, I think, only the degree certificate mainly, and one declaration form. In England also, it's pretty much the same. And you will have to get it attested by either a notary public or by your consultant or your senior. So they will have to put that it's a true copy of the original. They will have to write and put a seal. And you will have to put your institute seal also. If you got a mail saying your documents have been received, still not accepted, it takes time. Just wait for them to respond. If you just applied for it, usually the replies start coming only in the first week of November. Sources you need to prepare exactly. General surgery, Bailey and Love, anatomy, whatever resource you did for your PG preparation can be your neat PG notes, and use an atlas. Atlas, I would recommend either Netters or Anne M. Gilroy. I'll put it in the chat. Anne M. Gilroy. It's a Thine publication. This is what I used. Atlas. Physiology. There's a physiology video lectures on the app. They are very good, very short, and all that you need for your MRCS Part A. Pathology, just solve the questions. Read the initial few chapters of Bailey and Love, more than enough. D&B super specialty or MCA super specialty make a difference. Yes, sometimes you will be able to enter into ST5 or ST6 level if you have finished your MCH. Okay. If you have applied for RCS in England, can I reapply back to Edinburgh? You don't need to do that, buddy. Definitely not. why should you do that completely? Video lectures for all subjects, we are shooting it. It's going to take at least 1 month for us to do this thing. If your college is not listed in the medical school section of RCS England, you will have to mail them. It's going to be very difficult if your college is not there. Just check whether your university is there. Registrations for May, which is basically April 2024, will open in January. Or, yeah, January end they will open. There is no difference between which session you write. If you cleared your NEET assess, you should think of going for JAN exam. I mean, it really depends on whether you will be able to start studying right now. In fact, but because the counseling is going to take at least a month, you should be able to do it. If you are in your first year of DNB orthopedics, then it really depends on your work schedule, buddy. If your department is chill, you are able to come home by 6, then you can. If you're not, then I would say write it in second year. You will get the acknowledgements. Put your mails in the same thread. You definitely will get acknowledgement. Yeah. Hands-on training in UK compared to India, but it really depends from trust to trust. Get your basic general surgery training in India. Learn to operate well. In UK, certain surgeries you will do quite a bit. You will be exposed to more bariatrics, more colorectal. Emergency surgery, you will see less, but you will see a lot of diverticulitis and those kind of surgeries. So your general surgery training is almost a GI surgery equivalent training. Yeah. Is MRCS mandatory to get a job as a general surgeon in the Gulf countries? No, definitely not. It's not mandatory. All you need to do is a DHA exam or the local authorities exam. But you need, what do you call? It gives you an added edge. It gives you a better salary. Test and discussion and question bank is very comprehensive, very good, but you need to study theory as well, because there will be topics which are going to be covered in theory for sure. Yes. You have a professional degree certificate completed. If you're doing your DNB, then you will have a degree. It's kind of diff. I do. Try sending the provisional degree certificate. They don't care whether it's a bonded candidate. That bond statement doesn't matter. Neurosurgery scope in the UK after MRCS, it's pretty amazing, but it's very difficult to get into neurosurgery training in the UK. So if you've done your neurosurgery ENT, then you can neurosurgery MCH or DRNB, then you can go easier. Part A, it's going to be the same, buddy, for all orthopedics, general surgery, and ENT is going to be the same. Part B of ENT, I'm not very sure of the preparation. I will have to ask and get back to you regarding that. No, MS general surgery in India is not necessary to MRCS. You need only MBBS to do. I've answered the question about documents. You need a passport. You need your degree certificate. That's all. Is there a drawback for DRNB or MCH? No, dude. Of course, this is not the right platform to answer. It's an MRCS thing, but no, yeah. Are both England and Edinburgh RCS same? No, there are 4 colleges: Edinburgh, England, Ireland, and Glasgow. But the exam is the same. So you can apply for but you'll have to apply through either of these websites. Edinburgh. Snehita asked me, Edinburgh uni centers will be open to choose. I don't understand that question. As I told you before, RCS England and Edinburgh, there'll be no difference. Is MCH preferred over DNB when trying for MRCS after SS? But exam, nobody cares. Exam is the same for even post MBBS. After job also, it doesn't matter. Your training level matters. There's no advantage of MRCS this time. See, use any app material for this thing for basic sciences, anatomy especially. For everything else, Mortimer Green is enough. England, Edinburgh, no difference. Absolutely. If you're doing a 6 years DRNB neurosurgery, MRCS, if you're planning on some sort of training in the UK for 2 years, vascular neurosurgery, function neurosurgery, yes, you should be doing MRCS so that it's easier to get your GMC registration. See, Deepthi has asked me, during my internship, can I give MRCS board parts? As I told you, I don't No, because if you have your degree certificate, you can give. But I think you did in Philippines, so I don't know how exactly the system is. But if you have your degree certificate, you can give. After clearing MRCS, can we go for MRCS trauma and orthopedics? It depends. It depends if you have 6 years experience in orthopedics, including your PG. So ideally 3 years after PG you can do. GMC registration, exact cost I don't remember. Yearly fees for GMC is there. MRC is also there, around 15,000 rupees you'll have to pay every year. Pursuing DRNB vascular surgery, if you finished your MRCS, I would say apply at ST4 or ST5 level. As I told you before, documents, your degree certificate is more than enough, stamped, verified by a notary that it's a true copy of the original. Send a photo of it, scanned copy, that's it. You don't need to send passport. You need to have your passport for the exam. That's it. 4 attempts for MRCS Part B. But when you're doing surgical onco and after MRCS, you will have to choose a specialty. There's something called surgical oncology. You'll have to apply for colorectal surgery, breast oncology, or anything. This ST is specialty training levels. ST3 is where it starts. So it's CT1 and CT2, which is core training, and then ST3, ST4, ST5, ST6. Fellowships after MRCS, I think we'll have a different session about carriers after MRCS because it's kind of going in this thing. We'll kind of restrict it to this thing. So after provisional degree question, so you will have to send your, someone has asked me whether a provisional degree is enough. So you'll have to send the degree to RCS and then see if you are eligible, or else you may not be eligible. So I think a lot of questions have been asked today. Let's end the session right now. And if you have any doubts regarding last few doubts regarding the test and discussions or anything, just feel free to put it in the group. If you can answer, you can answer me. When is the next new MRCS part test and discussion batch starting tomorrow? Tomorrow 19th. They require for soft copy logbook. They accept a soft copy. There is a special website for this thing. I am not able to remember. I will send you that name of that website as well. Yeah. You don't need your MS degree certificate. You need only your MBBS degree certificate. Soft copy, and it has to be signed by a consultant. Your logbook soft copy has to be signed by a consultant. Yeah. Okay, guys. See you. If you have any doubts, put it in the group and I'll be able to answer it. Sometimes I do miss personal messages because sometimes there's a lot of flood of text. But yeah, so but you should try texting in the group and I'll definitely be answering it for sure. Good luck, guys. Hope to see you in the test and discussion. It's going to be a vibrant community. You can ask all your doubts. Dr. Rohan Khandelwal sir, me, Dr. Praveen Shekharan, Dr. Praveen Sundaram, all top faculty are going to be there. Make use of it. Thank you, guys. Good luck.